In this short video, I'll explain some basics of good oral hygiene and demonstrate an easy-to-follow technique. In order to clean teeth and gums properly, we need to know where plaque likes to settle on our teeth, and there are three distinct areas. First, it's the gum line, which provides a nice niche for plaque to settle, and the chewing surfaces in the deep fissures and between teeth. As a rule of thumb, 2 out of 3 dental problems start between teeth. Now, the toothbrush does not go in between teeth. That's why we need to floss or use interdental brushes. I highly recommend using plaque disclosing tablets. It makes plaque perfectly visible. Look at this before using tablets, and this is what the tablets reveal. Lots of plaque along the gum line. And these tablets even distinguish between old plaque that has been sitting there for days and new plaque. So the old plaque appears a dark purple and the new plaque has a pink color. Now, before we get started, this is important. If you notice bleeding when you brush or floss or use the interdental brush, it means your gums are inflamed. Healthy gums don't bleed. At this point, many people get scared and shy away and stop brushing. However, don't stop. Keep going. Remove the toxic plaque. It might look a bit scary to start with, but once you remove the plaque, the gums have the chance to heal, and it should get better from day to day. If bleeding is not going away, it's best if a dentist looks at it. Now, let's get started. There are some basic rules that we need to follow. Start brushing with the very back tooth, move from tooth to tooth and finish with the back tooth on the other side. And the toothbrush follows the gum line. And now we have to brush in 3 rounds. The first round is to brush the outside along the gum line. The second round is to brush the inside along the gum line. And the third round is to brush the chewing surfaces. And then we need to clean between teeth, either with floss or with the little toothbrushes. And this is the gum line. This is where most of the plaque accumulates. So that's why the toothbrush follows the gum line. We can use a manual brush, and we use circular motions around the gum line. So first round is on the outside, second round is on the inside. Again, we start with the very back tooth and circular motions. And then the third round is the chewing surfaces. Or we can use an electric one. We start behind the very back tooth and then we follow the gum line with the toothbrush. Again, we start in the very back, we work our way to the front teeth and all the way to the very back tooth, and then we finish off behind the back tooth. And then the second round, we move the toothbrush to the very back tooth between the tongue and the teeth, and we do the same. We start, follow the gum line until we get to the very back tooth on the other side and behind the very back tooth. And then the third round is the chewing surfaces. Now we need to brush between teeth, and again we start in the very back tooth. So we can use dental floss, and we start behind the very back tooth, and then in between teeth we start the front of one tooth and the back of the next tooth. And we finish behind the back tooth. Or we use the interdental one. There are 2 different sorts. So the classic one is, which is a bit like a bottle brush, and then the newer models, which are silicone ones. Starting between the very back teeth with the interdental ones, and in between goes between those teeth, you can rinse the brush with water. And this is the silicone one, which cleans also very well. So that's all you have to do to get good results brushing your teeth.